more about this. What is anxiety? First of all, we will discuss the overview as anxiety is your body's natural response to stress. It is a feeling of fear or apprehension about what's to come. The first day of school, going to a job interview, or giving a speech may cause most people to feel fearful and nervous. But if your feelings of anxiety are extreme, last for longer than 6 months, it are interfering with your life, you may have an anxiety disorder. Now we will discuss the anxiety disorders. What are these anxiety disorders? It's normal to feel anxious about moving to a new place, starting a new job, or taking a test. This type of anxiety is unpleasant, but it may motivate you to work harder and to do a better job. Ordinary anxiety is a feeling that comes and goes but does not interfere with your everyday life. In the case of an anxiety disorder, the feeling of fear may be with you all the time. It is intense, sometimes debilitating. This type of anxiety may cause you to stop doing things you enjoy. In extreme cases, it may prevent you from entering an elevator, crossing the street, even leaving your home. If left untreated, the anxiety will keep getting worse. Anxiety disorders are the most common form of emotional disorder and can affect anyone at any age. According to the American Psychiatric Association, women are more likely than men to be diagnosed with an anxiety disorder. What are the types of anxiety disorders? Anxiety is a key part of several different disorders. All these include panic disorder, experiencing recurring panic attacks at unexpected times. A person with panic disorder may live in fear of the next panic attack. The next one is the phobias. What are these phobias? Excessive fear of a specific object, situation, or activity. Social anxiety disorder. Extreme fear of being judged by others in social situations. Obsessive compulsive disorder. Recurring irrational thoughts that lead you to perform specific repeated behaviors. Separation anxiety disorder. Fear of being away from home or loved ones. Illness anxiety disorder. Anxiety about your health, formerly called hypochondria. Post-traumatic stress disorder (PTSD) is the abbreviation. Anxiety following a traumatic event. What are the symptoms of anxiety? Anxiety feels different depending on the person experiencing it. Feelings can range from butterflies in your stomach to a racing heart. You might feel out of control, like there's a disconnect between your mind and body. Other ways people experience anxiety include nightmares, panic attacks, painful thoughts, or memories that you cannot control. You may have a general feeling of fear and worry, or may fear a specific place or event. Symptoms of general anxiety include, what are these symptoms? Increased heart rate, like in stress, rapid breathing, restlessness, you may feel tiredness, trouble concentrating on your work, on your job, and on your sleep, not concentrating on your work properly, difficulty falling asleep, long night, awaken, too little sleep. Your anxiety symptoms might be totally different from someone else. That's why it's important to know all the ways anxiety can present itself. Then what is the anxiety attack? An anxiety attack is a feeling of overwhelming apprehension, worry, distress, or fear. For many people, an anxiety attack builds slowly. It may worsen as a stressful event approaches. Anxiety attacks can vary greatly and symptoms may differ among individuals. That's because the many symptoms of anxiety don't happen to everyone. They can change over time. Common symptoms of anxiety attack include. These are the symptoms of anxiety attack. First, we have discussed the anxiety symptoms, not the attack symptoms. These are the symptoms of anxiety attack. Feeling faint, dizziness, shortness of breath, dry mouth, sweating, chills or hot flashes, apprehension, worry, restlessness, distress, fear, numbness or tingling. A panic attack and an anxiety attack share some common symptoms, but they are not the same. In the next lecture, we will discuss the causes of anxiety.